I had a conversation with one of our advisors recently, and that's Dr. Habibi. And he said, well, Anna, I am a surgeon. I want to know more about the early therapy, about the non-metastatic. You always talk about metastatic and as if everything cool and new and hot is happening in the metastatic stage. Well, what is happening in the non-metastatic? And specifically, are there any new adjuvant therapies or neoadjuvant therapies that I could use as a surgeon I need to know about? I need to learn about them because when I am considering surgery and I'm sitting down with my patient, I need to know, I need to be educated. For me, this is an educational resource. So how could you use this to educate yourself when you have your free time, as I always say, between midnight and 4 in the morning? That's the only time our physicians have free time. So you will choose the non-metastatic setting. And let's start with various, obviously the adjuvant and neoadjuvant therapy would depend on the hormonal status. So let's start with the HER2 positive, so hormonal receptor positive, HER2 positive, and find out about the neoadjuvant therapy. So yes, as a matter of fact, what's new, we can see right away because it is right here in green. ADCs have appeared and have shown positive results as a neoadjuvant therapy in this specific treatment. We can select ADCs right here. And then there are 9 studies of ADC, so it's not just one study and recent, and we could explore the results. And what we could see here, again, that although none of these have been approved or appeared in any of the USA guidelines, these are phase 3 RCTs. The most interesting one is the one presented. Actually, it was talked about during ASCO, but we haven't actually seen the results. The only thing we have is a press release from that. But we thought, considering the press release says it's positive results, we should be on our radar and know it's coming. And, there are other earlier studies, phase 2 RCTs, but obviously we're all waiting for Destiny Breast 11 to release its full results so we understand them. And don't worry, they will appear here the day they are released, and so you will know about that. But going back, so this is what's new in neoadjuvant therapy for HER2 positive disease. What about, is there anything new, let's say, for triple negative in the neoadjuvant setting? So again, I selected very quickly triple negative, and now I'm going to select neoadjuvant and understand what's new for this. Well, there are 2 new things. There are ADCs, different ADC here that has shown positive results, but it's not yet appearing, not yet approved or not yet in the guideline. And there is a new olaparib combination but this is only for BRCA mutated patients. So not only triple negative, but triple negative with BRCA mutations, which obviously then we would have to select it as a biomarker, and then we will see it again. Again, you can look up at specifically this result, by limiting it to ADCs. There are 3 different studies, and you could see that one of them we consider on our radar. So this is beyond guidelines. This is something important for you to see, new and coming. That's why we tagged that. You could review the details. By the way, it's also connected to the clinicaltrials.gov. You could review the abstract. There have been multiple publications of that analysis. You could look at the publications right here. This was released quite recently at the ASCO meeting, so it's quite important to know what's new in adjuvant. And going back here, what if I select the HER2 negative disease? So I'm going to select HER2 negative and look again at neoadjuvant and see, yes, there's also news there, because you can see that there has been CDK4/6 inhibitor already in the guidelines and approved for that setting. But what is new is immuno-oncology combinations quite a bit. and quite a lot of studies here in this particular category. So if we would want to look at the immuno-oncology combination therapies and explore results, there are 7 different studies. And what's interesting is one of them, actually, it is an FDA approved, it's just not yet appearing in the guidelines. And again, it's interesting because it's just based on a phase 2 non-RCT, and there was a mixed population study, including the triple negative as well as the HER2 negative population. But you could read the paper right here to review the results. So a lot new is happening in the neoadjuvant setting. It's a very interesting area. There were quite a few publications during ASCO.